One of the biggest challenges of this pandemic is the uncertainty of it all. We really don't know how long this will last or how the country might change when this is over. Fox News' Roop Raj spoke to a doctor about what we have to do now and what's to come.
When you take a look at the current situation, how do you assess this right now?
The current situation is it's dire in many places. This is playing out as pandemics play out. The virus doesn't know borders. The virus doesn't care what your background is, your socioeconomic level. It's going to keep spreading, and it's going to keep infecting people. We've made some progress on the front of encouraging everyone to stay inside during this most critical period. And you've heard me say this before, that what we do right now, what we're doing right now to what we do tomorrow and the next day, all of that impacts what our life is going to be like moving forward. Now, remember, what we're experiencing right now is behaviors from 2 weeks ago at minimum. And so if you want to get a better idea of what 2 weeks from now in the future will look like, we have to look at what everyone is doing right now.
How much longer do we have to shelter in place, would you say, before we start flattening that curve?
The whole idea of getting back to normal, we need to redefine what normal is, because even when a shelter in place is lifted, the world that we're going to come back to is going to be a very different world. It's like on September 10th, 2001, we were able to go to the airport, go through security, keep our shoes on, our computers in our bag, no problem. 1 week later, that world changed. And that is the same type of change that we're going to see with the COVID-19 pandemic. The shelter in place needs to stay until we start seeing cases declining and the mortality figures could get under better control. But you can't just go from a shelter in place and then let everyone kind of go back out into society without taking some very important steps. And if you've been listening to public health officials, they've been talking about these steps. We need universal testing. We need to know who is potentially infectious so that they could be isolated. We need surveillance. We need to know where people are going so that we can make contact with them if they were around someone who was infected. We need resources for hospitals and all healthcare providers. We need economic relief to people who no longer could work in the same capacity, or families that can't feed their children anymore, and relief and support for schools. So this is we're looking for leadership to be able to implement these things, and this doesn't require anything of high technology here. This isn't advanced technology. This is basic public health measures.
Yeah, certainly a lot to take in, and sometimes not easy to hear all these details, but we understand this is a new reality. And Dr. Adam Rosh, we thank you for your time and your perspective. We'll talk again in the next week.